We will just wait a few seconds as people join the webinar in their thousands. All right, well, good afternoon. I'm Professor Shane Darke and welcome to the weekly NDARC webinar broadcast live to you from here at the Ballrooms of Mars. Before we begin, while we are widely dispersed across this country and in some cases in other countries, but we acknowledge traditional owners of country throughout Australia, recognise their continuing connection to land, waters, culture. We pay our respects to their elders past, present and emerging. Look, it's my real pleasure this week to be able to present Dr. Monica Barrett. Monica will be well known to many, if not most of us in the drug and alcohol field. She's currently working at the Social and Global Studies Centre and the Digital Ethnography Research Centre at RMIT in Melbourne. And prior to that, of course, she worked for 5 years at the National Drug and Alcohol Research Centre up until 2019. Now, Monica has had a research focus on how digital technologies and the cultures they sustain are transforming illicit drug use and drug use markets. In fact, I've opined on many occasions that possibly the biggest change over the last 2 decades has not so much necessarily been the drugs used, although that has changed, but the markets over which they're delivered. And that the whole coming to existence of the web has been a major shift during our lifetime. Now, particular relevance, Monica is the research lead for the Global Drug Survey. This is a large international online survey that monitors global trends in drug use and harm. Now, in this presentation, which I should point out is hot off the press, released only in the last week or so, Monica is going to address the topic of how the legal drug markets adapted to the emergence of COVID-19 and social mobility restrictions imposed across many nations. Now, we know that markets are indeed resilient and adaptable, but we need to know what's happening over the course of 2020, because it may have serious implications for treatment demand, overdose and other harms that we haven't even been aware of yet. So, as I said, to address this question, she's going to draw on a sample of people reporting recent illicit drug use from the Global Drug Survey. This has got respondents from countries as disparate as Germany, France, Brazil, the Netherlands, the UK, Australia. And it's probably, to my knowledge, the only global snapshot, and certainly the first global snapshot we're getting of what's happened in the last few months of this benighted year. Now, you can log questions onto the Q&A function in Zoom, not the chat function, please, but the Q&A, which I'll relay to Monica at the end of the presentation. If you could limit yourself to 2, please, the most. I may not be able to ask all of them, but I'll certainly do my best to ask and get them answered. So look, it's a real pleasure to have you here, Monica, and it's over to you.
Thanks so much, Shane. It's really excellent to be here, and thank you for your great introduction. So so my presentation today, Global Drug Market Shifts During the COVID-19 Pandemic, Findings from the Global Drug Survey. Before I get started, I wanted to make some acknowledgements. I have a number of collaborators on this project, and the Global Drug Survey has a massive support team, lots of media partners of research organisations and people who use drugs who participate and support us. And the collaborators I've listed here, Jason, Larissa, Marie, Caitlin and Adam, and there are quite a few more too. So thank you to all these people. But I'd also like to note this is actually a picture of the bushland near where I live in central Victoria in Campbell's Creek. This is Dja Dja Wurrung country. I'd like to acknowledge the elders, past, present and emerging from the Dja Dja Wurrung. And also it's sort of really poignant right now because for the last 6 months I've been working from here and not travelling anywhere. And that is the entire time that this project has been running for GDS's COVID-19 special edition. And also, I have 2 little kids, 2 and 6. and I have a husband who is essentially making this possible for me because he's the one out there right now. There's a locked door. I'm hoping that there won't be too much noise. But I also wanted to acknowledge I have so many colleagues, many of them women, mothers, who haven't been able to work through this period because they have had to care for their children. We love our kids, and it really tears us when we have to choose between work and children in this way. I just wanted to acknowledge that there's all these people out there struggling through this period. So yeah, it's hard. Having said that, with the assistance of my family here, I have been able to do some work during this period. And today I wanted to present this work on drug market shifts during COVID-19. So 4 parts, briefly looking at, I guess, the issue of drug markets and the 2020 COVID-19 pandemic. What might we expect in terms of changes, and what do we already know has been going on? Secondly, what is the Global Drug Survey and what can it tell us, and also what can't it tell us? Thirdly, the results of the drug market indicators from the buyer's perspective from this data set. I won't be going into the full results, which you're welcome to have a look at your leisure at globaldrugsurvey.com. And finally, challenges and opportunities from digital research during COVID-19. So really, I guess, just some discussion around the methods and what we can learn doing these sorts of things in this context. So the question of how might drug markets respond to the pandemic of COVID-19 in 2020, a couple of publications, I led one of them, but also by colleagues Paul and Amy down there. I've got some references at the bottom of some of these slides if you're interested in pursuing further, is looking at how this situation might result in decreases in drug supply or increases in drug supply, decreases in drug demand or increases in drug demand. And in terms of constricted supply, there are, in terms of the pandemic itself, restrictions on distribution routes, reduced legitimate flow of goods. We know that goods like prohibited drugs do travel through legitimate pathways. That's how they're concealed. When those legitimate pathways, like for example, people who travel in and out of our country can no longer do that, then it's much harder for those goods to flow. And also, I guess, in terms of social supply, we know that for many people, social supply is how they access drugs. And when it's harder to meet your friends or your dealers to exchange drugs because of the social mobility restrictions, then we might expect some reductions in availability. Having said that, there's possible ways in which it might increase supply. One of the pathways that we explored in Judith and my publication in IJDP was the concept of an economic downturn, which we're currently experiencing, I guess globally experiencing. It might mean that there are more recruits into drug market supply due to there being less legitimate employment opportunities available. I don't really think we're going to see that playing out just yet, and certainly with the way that government has supported many people through JobKeeper and JobSeeker, it's harder to see that happening. In terms of demand, some of the flows in either direction, thinking about mainly the closing down of public leisure settings in terms of demand. We would expect that certain settings being closed down would result in people being less interested in using particular drugs. Obviously, if there's massive sickness and death from this pandemic, then there's going to be less people around, and less people, even if they don't die, but if they're just sick, they're not going to be necessarily consuming some of the drugs, depending on which ones you look at. And looking at increases, a major mechanism is increased psychological distress, which could be related to the economic downturns, meaning that more people may want to use more substances. Increased demand from drugs typically used at home or in private settings. And for some people who are just simply bored, that there might be more drug use there. And the caveat is that the nature, the length and the severity of the pandemic and the responses do matter, as do the drug types. So what do we already know? I'm sure there's more research out there, but this is the ones that I'm aware of. And I just came out of a talk at Monash Addiction Research Centre at 2 o'clock just today, where Paul Dietz was speaking about some of his data, which I've now included in here. So we've seen certainly evidence from WA and Victoria now of a constricted market for methamphetamine. So these are significant price increases reported by people who use methamphetamine in those states. Looking at the European EMCDDA reports, we've seen evidence of decreased cocaine and MDMA use confirmed by wastewater. We've seen sort of mixed stuff going on with cannabis use, some increased cannabis buys on darknet, but smaller buys rather than larger buys, so indicating that potentially some people are going to the darknet directly rather than, say, wholesalers or retailers going to the darknet to buy larger amounts, which they would then sell off face to face, as that would be harder to do in these contexts. And NDARC's EDRS and ADAPT studies have shown increased cannabis use and decreased MDMA, cocaine and ketamine, but mainly stable access to drugs. So in terms of what the Global Drug Survey is, as Shane's already mentioned, we're the world's largest drug survey. We've been doing this survey since 2011 annually. And the mission of GDS is to promote honest conversations about drug use to help people use drugs more safely, regardless of the legal status of the drug. So the GDS website has a range of harm reduction apps and tools that people can use. We're able to respond promptly. So I guess I was a recipient of that, being able to put in place very quickly a module of GDS on Silk Road back in 2012, which enabled us to look at something that was quite new at the time through this mechanism. And GDS is funded through bespoke data reports and data access and partnerships with universities. So we published a paper about 3 years ago now, moving on from representativeness, testing the utility of the GDS. And I guess what we were trying to look at there was if we compared samples, and we had a look at samples from National Drug Strategy Household Survey and other equivalent representative samples across the world, if we looked at the actual people that completed those surveys that had used, say, in this case, cannabis, they weren't really that different to the people that completed GDS. And so although there is absolutely prevalence data is really important, what we are able to say is if you want to look beyond prevalence data and you're interested in trying to understand the detail of what's happening for people who use particular substances, you know, maybe we should question whether or not we need representativeness to do that, especially given the heavy price tag that that has. So we think there's a particular, I guess, benefit you can get from the Global Drug Survey methodology. So we were doing our GDS as we normally do, and then suddenly this all happened in March. The word pivot has been used many times amongst my circles in the last few months. We had to work out what to do. Should we run an additional survey? If so, what should we ask? So we decided to go for it, and we put together this cross-sectional anonymous survey with the aim of understanding the impact of the pandemic on people's lives, focusing on drugs and alcohol, mental health and relationships. We never offer payment for our survey, and I guess one of the things to note there is that helps us to keep it completely anonymous, and we hold that to be more important, even though, as many of you who've read my work know, that I'm very keen on reimbursing people who use drugs for their time and energies when they do work, when they do research and contribute. The issue here is that to do that creates a problem for anonymity, and there's more to discuss there. I know Amy's done some work trying to work out ways of paying people, but we don't do that for GDS. The data was collected May to June 2020. And when we were asking questions, we were asking about the last 30 days. So bearing in mind that this data relates to, in a way, April to May, and that means it's not necessarily, you know, a lot's happened since then. So it's sort of like the first part of the pandemic. It was available in 9 languages, and we had recruitment through mainstream and alternative media partners, paid and organic social media posts. And just some examples, this was what Vice put out for us. We had, you know, partners like DJ Mag. On the other side of the screen here is an example of one of our paid Facebook ads. So that paid Facebook ad was very much, you know, can we get the festival goers, the club goers to do this survey in that ad. We also had The Guardian and Vice putting out interim findings as a way of encouraging people to continue. So about 3 weeks during the data collection, we produced interim findings for that as well. Now, during May, we had the Black Lives Matter protests and movement, and tragically, George Floyd was killed. And this is Larissa here, actually, who's on our team at one of the protests. And this had a massive effect on our recruitment, because we didn't feel it appropriate to be trying to put out this kind of approach, especially in the US and even in most parts of the world, when there were media blackouts to try and assist this particular movement to get traction. So it gives you another example of how, yeah, you can be doing something and then you really just have to pull back and respect what's going on in the world at that time, which we did. So we have a lower US sample than we would have liked. In terms of market indicators, we had to work out how to measure this, and we asked the question, compared to February, before the COVID-19 restrictions, has the number of days that you use drug type in a typical week changed? We asked for if they had increased or decreased, the reasons for that. When was the last time they'd successfully purchased a drug? If that occurred during COVID, then which drug, what source, how is it accessed or delivered? Was the transaction different? Or why did they not purchase during COVID? And in general, what changes do they think that the pandemic had on illicit drug markets in their country? So that's the general question, which we'd expect to get a much more, I guess, a stronger answer to that question. People may then be referring to people they know, or even just hearsay rather than their own experience. So in terms of looking at this for analysis, I grouped the response. We grouped the responses into anything that indicated increased demand, decreased demand, increased supply, decreased supply. Then we looked at price indicators, and I mean, there's sort of classic economics graph here that's indicating that, you know, when the shifts of the curve of demand or supply go in either direction, then we would expect price to move. Now, as Shane mentioned earlier, some markets are more elastic than others and therefore are less likely to move. We also looked at substitution and stockpiling, so I'll go through all of those in turn. But also just a note here, these were the 20 drug types we measured. Could have been more, obviously, but we had to cut it somewhere. So we didn't even look at tobacco. There was a whole bunch of things we didn't look at, but we did look at these. And there were 4 categories of prescription drug that we looked at as well, which you see there with the asterisks. I put this slide up, I'll repeat it later at the end. These are the limitations and cautions with this data. One of the main things is it's self-report cross-sectional, so we're asking people to tell us whether they believe something has changed, rather than, as Paul Dietz an hour ago at the Monash pointed out, obviously it's better to have a time 1 and a time 2 and to make that call yourself as to whether things have changed or not. You're relying on people's recall. That is what we've got here. We're also looking at the buyer's perspective. So we're asking people about their buys. We're not asking them about their selling. We have cautions around interpreting country differences, given that there are differences in the way that the countries have recruited and differences in responses, obviously, to COVID. Global Drug Survey is aspirationally global. We do not cover all countries in the world, and we definitely don't have as much coverage in African and Asian countries. And we don't cover people who are in unstable accommodation or with lower digital literacy. So we have to keep that in mind. So in terms of the demographics, we had over 25,000 people who reported use of a currently prohibited substance in the last 12 months. So they're included in the sample here. And you can see on the right-hand side there, I think you guys can see the same side as me, the ends, some of the ends, and I'll do this throughout. If they've got yellow on them, then we should be cautious about interpreting from them. But we did have just over 1,300 from Australia. In terms of their demographics, this is global. We had a preponderance of young adults in the sample. And this is really just to get the ends, so don't have to take too much notice of this slide, but in terms of cannabis is where we have most of our N, and then we have many thousands of people who have reported the use of MDMA, cocaine, and a bunch of other drugs there. And you can see a lot of the prescription drug use was actually prescribed. I've included those people anyway because they could have also increased or decreased their use of those substances, where they're not excluded from the data. So this is a busy slide. This is change in frequency by drug for the global sample. And the blue bars are decreased, either a little or a lot, and the orange bars are increased, either a little or a lot. And what we see there is that THC cannabis is by far the drug that's most likely to have increased among those who already used it before the pandemic. And there's some caveats there on some drugs that have very few people. We can see, for example, heroin has very few people in this data set. It's not a data set that captures people who use heroin, but amongst those people, it was more likely to be used to increase in use. Prescription benzos was the next one that was most likely to have increased. In terms of decreasing on the other side, MDMA, cocaine, amphetamine, and ketamine were the drugs most likely to have decreased. I've done the same slide for Australia. I've removed anything we had N less than 100, and we see very similar results there with THC cannabis and prescription benzos most likely to have increased, and MDMA, cocaine, and ketamine most likely to have decreased. If we look at cannabis, which we have the most N for by country, it's a pretty similar story across countries. Brazil looks a little bit different, but yeah, it's pretty much a similar story. And if you look at MDMA, I think that's a pretty similar story as well. So we had a lot of similarities in terms of that particular finding. So looking at the each in turn decreases in demand, and I'll go through each. The total decreases in demand across all drugs, this is drug independent and global, 35% of the sample reported at least one indicator of decreased demand. And when we looked at which drugs on the other side, it matches what we saw before. This was MDMA, cocaine, amphetamine, ketamine. And the most common reasons that were driving that were that they had less occasions to use the drug and less contact with people who used that drug. They didn't like using that drug at home, and they didn't feel like using it in a pandemic. In terms of increases in demand, this was 40% of the entire sample, so it's slightly less than slightly more than 35% of increase in demand. And that was, as we mentioned before, related to cannabis and benzos in the main. And the first few reasons why people were saying they were using less using more, was that they have more time to use this drug and they were more bored. So looking beyond that for people more around mental health and coping with the pandemic, I'm more stressed by what's going on, I'm feeling more depressed, lonely, etc. was also there, making that up. In terms of measures of decreased supply, that was 17% of the sample had some indication in the data set of a decrease in supply, and that was mainly driven by it's been more difficult for me to access that drug, and that was mainly driven by cannabis actually for some people. In terms of increases in supply, we really had very little indication of increases in supply. It was only a single item, 5% of the sample reported it's some drug that they were more able to access. So then looking at price, I've divided it into better value for money was lower price and or special offers. And then for worse value for money was higher price. So we were much more likely to see people report worse value for money, and that was mostly associated with cannabis, also with LSD, but there's low numbers there. And this is global data. And we don't really have enough with methamphetamine to make any comparisons to say the data we know about in Australia, unfortunately. In terms of substitution was things like the reason they might have increased use was I'm having difficulties accessing other drugs, or during the last purchase, the drug I wanted was not available, so I bought a different drug. This was really uncommonly reported, only by 2% of the global sample. Unlike stockpiling, that was reported by around 15% of the global sample, and this was a composite of reasons for increased use, having larger amounts than usual at home, so that's why they've increased use, or during their last COVID purchase, they bought in bulk or greater quantities, or why they didn't purchase recently was because they were still using their stockpile. and that was mainly related to cannabis. So looking at these market indicators across 3 drug types that we have the most data for on a global level, again, we can see there clearly increased demand was there for cannabis, much more so than for cocaine and MDMA, and the reverse was true for cocaine and MDMA in terms of decreased demand. There's some indication of constricted market supply, not much indication of expansion, and then there's the stockpiling for cannabis. Looking at the same graph for Australia, it's the same trend but more pronounced, essentially. More of our sample down here were reporting decreased demand for MDMA and cocaine, and more of our sample down here were reporting increased demand for cannabis. So we did ask the general question, and this was not related to particular drug types, but has there been any change in drug markets in your country, do you think? And across the global sample, more than half said yes, there'd been a decrease in availability. More than a third said there'd been an increase in price. And the other 2 were relatively stable, coming up to 1/5 saying there'd been a decrease in purity. And when we look just at the decreased availability by country, it was quite significantly different. Well, quite different. Haven't done statistical significance on it, with Australia coming out at about 51%. The Netherlands, notably, is less likely to say they've had a decreased availability. So looking at source and delivery mode, what we did was we asked people, when did you last purchase an illegal substance? What month? So some people chose January and February, others chose March, April, May and June. And for those, so I've put them into 3 groups here. The grey bar is pre-COVID, essentially, January, February, and then we've got March, April, and then May, June in the blue. So there wasn't a massive differences here when we looked at the purchases in this way. One that's worth noting, I think, is the delivery mode. I met the supplier in a public location. For January, February pre-COVID, that was 28%, whereas in the COVID period, it was 23%. But look, it's not a lot of difference, and I doubt that these were statistically significant. So it will be interesting to see, to look more into this, I think. This is for all drug types, so there could be some differences between drug types as well. So we were also interested in, and me in particular, I was interested in the potential for new take-up of digitally facilitated supply. So we asked the question, when people purchase a drug, was the transaction different compared to your experiences pre-COVID? And 2% reported that they had used a mode of supply, it could be darknet or anything, for the first time in that last purchase. So it's a small number of people, caution there, but they are the blue bar in this graph. So we see that the mode of supply they'd used for the first time actually includes social and messaging apps, darknet market, and also stranger dealers. So dealers they don't know as opposed to dealers that they do know. Whereas, yeah, when you look at this is compared to everybody else where it wasn't their first time, they were much more likely to talk about friends and known dealers. Okay, so summarise all the findings. It's sort of hard to do that, but just remembering, I guess, the question, how have drug markets changed in light of COVID-19 and the social and mobility restrictions imposed across many nations? I think there are many stories here, and we see stability of markets for most, with signs of constriction in supply for some markets, for some drugs, for some countries. There seems to be, I've said here reduced demand with some signs of increased demand. I mean, when we go back to the earlier slides, 40% of the global sample have some indication of increased demand, and 35% of the global sample have some indication of decreased demand. So yeah, I think there's many different stories going on here, and it's a shame that Amy can't be here today. I know she was keen to do this, but I think the Australian data does look quite similar to ADAPT, and we need to do some further detailed comparison on that, given that the samples were collected at a similar period and there were some similar items asked. So just repeating this slide, I guess, reminding us of the limitations and cautions of what we can and can't know here. you know, it is important to remember that when we look, say, at the country differences, there can be other reasons to explain those country differences, and yet some of them do match with what we'd expect. We would expect, for example, that the Netherlands sample would be less likely to say that there was decreased availability there, as they do seem to have better access to many of these substances than other markets. So often, while we have these caveats, we also put the country comparisons through a filter of what else do we know, and does this make sense to us? So finally, the challenges and opportunities of doing this kind of work. I think, you know, what we found and what a lot of other people I know researching in this pandemic have found is that the recruitment of samples, it's not particularly easy at the moment. There's digital saturation, there's lots and lots of surveys vying for everyone's attention. For some of us, as I mentioned earlier, with family responsibilities, this is not a period where we have nothing to do. This is a period where we're very busy. And for others, as we've seen in the survey, they're really bored. So there's a really a vast difference in people's capacity to contribute to surveys like this. I think we always need to have triangulation with other samples, and different samples have their strengths, but also triangulation with other data, police seizures, wastewater, drug checking in countries where that's possible, really help us to situate what we're doing here. There's a great article written by Palomar and Acosta that came out recently around the issue of paying participants for digital research. They were very keen to pay their sample, and they were pivoting from normally doing research outside nightclubs, talking to people face to face, and they'd then gone to online. They wanted to pay people, but because they started paying people online, they got a lot of fraud. And so this is one of the reasons why we avoid that, but they felt that, you know, we should do that. So I guess it's an area where, you know, if we can come up with some better systems, perhaps we can provide, you know, an appropriate amount of payment for people who complete these surveys. But that does then lead to the issue of anonymous versus confidential, cross-sectional versus longitudinal. This is a cross-sectional survey. Having longitudinal data does really strengthen what we can do, but to do that we need better systems. We need to be prepared as participants to provide our contact details for a survey about a prohibited activity that may be an issue that people aren't prepared to do. So I think there's lots and lots of challenges and opportunities, and certainly interested in discussing those with you today. So finally, I'd just like to acknowledge RMIT and NDARC. I'd also like to mention the globaldrugsurvey.com website, because you can access our interactive reports there. So please have a look at those, and back to you, Shane.
Great. Thank you very much, Monica. What an excellent presentation. As I emphasised to the audience, it's hot off the press. Can you unmute? I know you're on mute, sorry. Look, my first question, we got this right in the early, and it's a very quick one. Monica, Nardine, I think it might be Dr. Izzard, is asking about 14 to 25-year-old age group. I know you said under 25, but how low does it go, do you know? 16.
So we have 16-year-olds and above in the sample.
Yeah, because otherwise you run into ethical issues, or?
Yeah, and indeed, often in Australia, we're unable to have 16 and 17-year-olds participate in this kind of work. Because we have a primary approval through University College London, we've been able to do that. But I know many people in Australia have struggled to get 16 and 17-year-olds, you know, approved.
Yeah. A question from Anthony Bolton. I was talking about Brazil. It's really, do you think the results are influenced by Bolsonaro's approach to drug policing? That it may be a standout. Is there any observations on that, or?
Yeah, well, I mean, what I would say about the Brazilian data is something that we haven't included today, but is on the website to look at. Is we did ask everybody, how did they rate their government's response to COVID-19 out of 10? Yeah. And in Australia, we had a 7, and New Zealand had a 9. Brazil had a median of 0. And I checked that. I checked it over and over, and it was indeed a median of 0. It was something like 67% said 0.
Yeah.
So they were not happy with their government's response, at least the sample that we collected, which was a few thousand. And they were very unhappy. And so having said that, I noticed the Brazilian sample really drops off when we start to look at certain drug types. So, you know, like cannabis, I think we have enough in, but like when we looked at MDMA, it was only a couple of hundred. So I think the sample that we got may have been more alcohol only, cannabis only people in that particular, I believe we had a media partner in Brazil that was doing most of that. So it wasn't through paid ads, targeted ads, it was much more that local media partner. So that could have an effect because that media partner might be particularly negative about the president. I mean, I understand that there's much, you know, controversy about what's happening in Brazil. So yeah, I think it could have an effect for sure.
Yeah. Look, I got a question from Don Weatherburn, Commodore himself.
Hi, Don.
He's been looking at some data recently showing big jumps in arrests. This is New South Wales data for use, possession of cannabis and methamphetamine. I'm sorry, the screen keeps on jumping in front of my eyes. But no changes for other drugs. So the jumps have been for cannabis and methamphetamine. He's just wondering if you had any ideas on this.
So there's jumps in arrests in
for use and possession, this is of cannabis and methamphetamine, but not for other drugs. It seems to be a trend specific to them. And we've talked about this, he's not clear either. He's just wondering if you had any ideas why that would be the case.
Well, I guess, so the other drugs that would normally be in that data set, would that include MDMA, which, you know, if this survey has any connection to what's actually happening out there, then we would expect less MDMA arrests. And I think MDMA arrests would be happening at places that are no longer operating, like festivals.
Yeah.
So, you know, when you think about that, there would be some effects. But and I mean, you know, I guess I wonder how it would work with policing. And we do have some data on policing in the Global Drug Survey. I haven't presented it today, and certainly we can look further into that. We've asked people about whether they've been arrested or encountered police, but we didn't actually ask them about which drug. So it might not help as much to disentangle what you've just said.
No, but I think you've given us food for thought on situational differences. So festivals being an excellent example and related to particular types of drugs. We've got a question here. Got many questions. Well, and observations. I'll just pass this on. It's an observation because it's relevant to you from Joseph Kerr as a nurse practitioner in AOD. In rural Victoria, says definitely feeling the drying up of the cannabis market in areas that are usually very high supply and getting more clients wanting assistance for cannabis withdrawal. So there may be like regional differences. Obviously, you're not going to pick that up, but
absolutely. And I mean, what we haven't done, and maybe I can do that prompted by your comment there, is we do ask people whether they come from an urban or a regional area. And we had the most responses in Victoria, and indeed 8% of the Australian responses were from regional Victoria. So we can definitely have a look and see. Having said that, you know, I think one of the issues is that right now we're in a different phase of the pandemic, and especially given Victoria's situation in the last couple of months, you know, it might be that people hadn't experienced these things back in May, but they're experiencing them now.
So the AOD workers may be seeing this flooding in Victoria in the last 6 weeks or so.
Definitely.
Very interesting.
Certainly.
We've got a question here from Rebecca McKetton. Rebecca's wondering if you've been able to compare the characteristics of those who report decreased or increased substance use. Are they two different groups, or is this just...
Yeah, that's exactly the next question, Rebecca. You know, is a regression, I think, looking at that. So I was thinking something like multinomial and have the, you know, the decreased and the stay the same and the increased groups, and then sort of see what demographic characteristics and frequency of use characteristics, etc., might sort of predict those pathways. So that's definitely, I think, would be an area to go to now.
sort of related to that, I suppose. It's tangential, but Jason Greebley from the Kirby Institute, it's like Old Souls Week here today, isn't it? Says, nice presentation, Monica, but he's just asking if, GDS, you actually collect data on injecting drug use, because he's wondering if you've seen any changes in injecting drug use patterns.
Yeah, great question. We've got a one item in there about have you injected drugs in the last 12 months, and then and I haven't shown it here, I'd have to have a look to see what numbers we've got. I know they're low, but we do ask the question. And then I think I mentioned at the start of the presentation that we had Input as a partner, and Judy Chang from Input helped us to develop a little module to only be shown to people who had used any kind of opioid in the last 12 months, prescription opioids or heroin, or etc. And then asked about pharmacotherapy access and this kind of thing, and also about overdose response, so naloxone. Unfortunately, and as you would expect, we had very little responses to that. So we do have a global sample of a few hundred, but it's, out of 25,000, it's a very small number. And of course, it's disparate across the world where they come from. So it's hard to really work out what to do with that data.
Heroin's a marker in this country for injecting, but it's not in the UK, for example. So,
yeah, that's right.
Listen, I suppose you actually alluded to this, Monica. Frank has asked information regarding access to treatment because of social interaction restrictions. So you might have, are you looking at is that affecting treatment access?
Yeah, so we did ask about whether people would normally access any kind of services. So we didn't restrict it to treatment as such, because most people in the sample aren't accessing treatment, but this could be drug checking services or harm reduction services or peer education or whatever. And if they were accessing those services, are they having trouble doing that? So we've got a small sample of people. I haven't looked at them by Australia, so that could be something to do in terms of whether they were experiencing access issues. We even asked them whether they were experiencing better access, because we know for some people, like with pharmacotherapy, the COVID has sort of paradoxically made it easier for them to access, in the sense that they might be able to do take-homes where they weren't before. So we've also asked that, but we haven't done a lot of analysis on that yet.
Show the complexity that arise. Got a question here, which is a topic that's actually always been dear to my ageing heart, which is from Robbie Ald. Interested in insights on benzos in Australia, particularly young people. Was your focus in this solely on the NPS benzos, or is it also upon benzodiazepines?
It was both. So in two separate categories. So prescription benzodiazepines, and we put e.g. Xanax, Valium, etc. And then the other one was novel benzos, e.g. Atizolam, etc. So that was what we asked. And in Australia, there was very little reported use of the novel benzos, but I know that there's been some discussion of the use of novel benzos, especially in New South Wales. But we didn't really see a lot of that in our sample.
But benzos has been such, there's such wide availability in use traditional benzos. Maybe there's no unsoaked market for it. I don't know.
And it was the drug that the prescription benzos was the second most likely for people to say they had increased during the pandemic. And what I haven't done, I guess, is looked at the issue of whether that was amongst people for whom it was prescribed, or whether it was amongst those for whom it was not prescribed, and how those patterns might differ. One might expect that for those for whom it was prescribed, they might have a more stable use, but maybe not, because they're using more of them. I'm not sure. So that could be something to look at. And certainly we haven't done any state analyses either. So that's another thing we could do to look at what's going on with benzos.
Tim Powell's just commented on that. He's wondering about state by state variants, but I think from our previous conversation, you haven't had a chance?
Yeah, no, I haven't done it. Yeah, it's literally just, yeah, it's getting it getting it out for Wednesday was like that was a push. So yeah, looking at state variation will be something to do. I did have a look at the state breakdown, and we do have more Victorians than we kind of should if we were representative of Australia. So, you know, for whatever reason. I won't take a claim for that, but maybe I shared a little bit too much down here. I don't know, but we've got a few more Victorians than we'd expect, but we've still got, you know, plenty New South Wales.
Well, just related to Victoria, Joseph Carey, the nurse practitioner I mentioned before, just notes as a comment. It'd be interesting if benzo use Victoria is borne out in the safe script prescribing data. There's triangulation.
Yeah, absolutely. Yeah, looking at
the thing about benzos is problematic benzo use is associated with any number of poor clinical outcomes. It's a drug to always keep an eye on.
Definitely.
Annie Bleeker again. I told you it's Old Souls Week. Just says excellent work, Monica.
Hi, Annie.
Thanks. Now, Professor Michael Farrell, Director of the Centre, says thank you for an interesting presentation. And he's got any thoughts on the rise of illegal festivals as a risky development? I'm not sure if well, I suppose more broadly, I mean, not if you're looking at that or if you've got any views on that.
So in the survey, we asked about settings of use, both before and during COVID period. So we did ask about illegal parties as well as actual, you know, clubs and pubs. And as you would expect, most people in April and May said they had not used those substances in those kinds of places, but there was a small proportion that said they had in these sorts of illegal parties or parties that were not legal under the restrictions. So that was there in the data, and you know, we haven't done much more than just noted that it was there. But we would expect that there will be people that will be having parties during this period. But I mean, the other thing that was borne out was the reasons why people had decreased their use of drugs that are typically used in leisure settings. And many of them are saying they just don't feel like using them in a pandemic. So, I mean, for some people, you know, it didn't really make sense to be partying right now. Yeah. But I think there'll be a small proportion for whom that's not the case.
Yeah. Fadil Pettick, I remember you. He's just written Old Souls indeed, Shane. We shared an office back last century. Now, we've got a question here, which I think is very interesting from Western Australia, because we're going back to the jurisdictional differences. And the thing is saying we've noticed an increase in nitrous oxide use, NANGs, they call it, in WA. Some using it at high levels, experiencing adverse events and presenting to accident emergency.
Yeah.
Would you consider using this in your, I mean, is this part of the survey or would it be, is nitrous oxide, I can't remember whether nitrous oxide.
Yeah, we decided not to include nitrous or amyl in our list, and we regret that because as you've noted there from Western Australia, but also it's been noted in Victoria, that there's been an increase in presentations to emergency departments related to use of nitrous that has caused problems. And look, so it's one of those things, you know, it's April, you're in a pandemic, you have to make decisions on the fly, and that one I regret. But so we can't tell from our data, but I mean, certainly, you know, looking at other data, and I'm sure there will be, and you know, we'll have another GDS at the end of the year where we'll use the full gamut of drugs. And indeed, you know, looking back from, imagine you're doing this survey in November, looking back over, you know, it's a longer period to take into account rather than this sort of really quite short period that we did this survey in as well. So obviously,
you know,
sorry.
Every bit of research, there's always something you could have asked.
Or mistakes you made. We forgot to put pubs in the list of settings, for example, which we realised the very day we launched, but we couldn't, you know, so we had clubs and festivals and then we're like, oh, well, anyway, so it's okay.
It is okay. There's always another survey. You know, it would be interesting, again, we get a comment that alcohol, and I know you look at alcohol separately, but there's going to be interesting trends, like maybe in Victoria when you're out of the various lockdowns, it might be very interesting to see alcohol-related harms. and consumption in the coming years?
Yeah, and I think there's been a lot of surveys, and some surveys yet to be released, that are doing the alcohol measurement in a really refined way, like out of La Trobe, and I know Alison Ritter's group even doing one for New South Wales that'll be released in a few weeks. And what we did was we did measure alcohol change with a little bit more precision, because we asked about frequency, and then we asked about the typical amount you used on a day that you used, and then we also asked about frequency of binging. So we did have more measures, and in doing that, I looked at the Australian data on that and reported a bit about it last week. We had, I think it was nearly 40% of the sample went both ways. So we had around 40% said they'd increased in some way. One of those three measures had increased, and about 40% said one of those three measures had decreased. And I put in a different category those with mixed, so they were there too, and then there was stable. And so then the story that came out of that for people that was surprising was the decreases, the fact that there was this group that was decreasing, and we looked at them, and they were mainly, young people that said the same thing as for the drugs we mentioned today, didn't have the same settings of use and didn't have the same people they normally use with. So they like to go drinking, like to go out, don't like to drink at home.
Not necessarily
so
dependent people, situational.
Yeah, situational drinkers were saying, well, I'm not binging as much anymore. That's my decrease. So that's different, very different to, say, someone that's drinking daily that might have a different experience.
Absolutely. And I think we'll start to wrap up. We've got a question from Jack Wilson, and it's an interesting one too. Different cannabis products. I know you did CBD separately, but he was thinking of Sensimilia or seeded herbal, but it was, I mean, I suppose you could also look at vaping, for example.
Yeah.
Is there any data on types of cannabis?
Yeah, well, in this survey, we only asked about two categories. So THC containing cannabis products was the statement we used, and then CBD only cannabis products. And I mean, the CBD only products is much more common elsewhere in the world. There's still a little bit of it here. But yeah, we didn't disaggregate it any further there. Certainly, we've got a lot of data in the main GDS that goes into a lot of detail about that. And yeah, we didn't ask about vaping. Again, we wanted to, but we realised we couldn't ask too much. But
you can't ask number.
Yeah, so we don't have that data on vaping, but yeah, we're definitely going to do some more stuff on vaping in the next GDS.
Just relating to alcohol, Frank's said that he's talking about a UK study showing similar things: 21% increased consumption during lockdown, 35 reduced.
Okay.
He's wondering about, I think this goes back to your substitution thing. Was there any information on polydrug use for those who increased alcohol consumption? Did they increase consumption and decrease other, or increase all, or was it completely unrelated?
Yeah, and we could look at that, and we haven't, and we definitely should. So thank you for the tip there. In terms of thinking about that, how many different drugs did people increase, or did they increase and decrease? I mean, I did look at that substitution reason, like where people said, I used this drug because another drug wasn't available, but I haven't done the analysis including alcohol.
No.
And we did have alcohol as an option there, so we could sort of do that a bit more with alcohol, I think. Yeah, thanks.
The substitution, it's, to me, over the years, certainly when you look at treatment, there's always been an argument that people will stop using their main drug and suddenly switch over to others. I've never seen any evidence for it. It's quite an interesting thing that what you're basically saying is people couldn't get a drug, but they didn't substitute another necessarily. People like what they like, maybe.
Yeah, so I mean, how substitutable are particular drugs, and maybe for some drugs, it might be that you do that, but yeah, it depends on the pathways, doesn't it? Yeah,
no, I agree. And I think, well, one final question, because you've been a real trooper there, you've answered an infinite number, so we'll make it an infinite plus one. Just talking about GBL or GHB as well, but I can't remember whether what you were seeing with that.
Yeah, so we had less than 100 people in Australia report the last 12-month use of GHB GBL14B. So yeah, we felt a little bit uncomfortable
Yeah,
making any
yeah,
sense of that. So yeah, that just wasn't in our sample in the
yeah,
end. But I know that there have been some concerns, especially down here in Victoria, about the use of GHB potentially as substitution. But yeah, we haven't seen anything to really corroborate that either
yeah.
way, you know.
It's a
Um,
dangerous substitute. You know, my colleagues and I published a paper this year on that
yes,
one,
I read that.
desperately, but
Yeah, yeah,
it's
yeah. No, it
certainly
definitely.
something to keep an eye. But
Mm.
you can't ask about everything at all possible combinations. You'll be spending many, many months analysing those data.
And people won't do the survey. That was our main concern.
Yeah, there you go. Look, it's fantastic. Here on Mars, where I'm broadcasting on, people are cheering on the dunes. It's really exceptional body of work, and I think it's probably internationally what you've got is one of the, if not the leading international sentinel study, really is, which, getting back to your earlier comments on representativeness and sentinels. But it's a wonderful body of work, and I think you can see by the excellence of the questions you've had that people are very interested in it. And thank you very much, Monica. Thank you all in the audience for watching. It's been a real pleasure to present Monica today, and I wish you all a wonderful afternoon and an excellent evening. Thank you.
Thank you, Shane.